Hello friends, welcome back to Complete Medical Coding. Today let's discuss few guidelines from anesthesia, coding anesthesia. It's very easy to learn anesthesia guidelines and also it's very easy for you to score marks from the anesthesia part. Okay, so let's discuss few guidelines today and some examples as well. Alright, so friends, please support me. If you are new to the channel, please subscribe, like and share my videos. So let's go to the guidelines. Okay, anesthesia guidelines. Anesthesia procedure codes are separate 5-digit procedure codes assigned only to the administration of anesthesia. So anesthesia is usually, as you know, it's a 5-digit procedure codes. Okay, there are 5-digit procedure codes, and these anesthesia codes are assigned only to the administration of anesthesia. Okay, only for that, for administering anesthesia we will use anesthesia codes. A general procedure number is given within each category, followed by exceptions or specific listings. The anesthesia section in the CPT code book ranges from, so this is the range, the anesthesia for the anesthesia coding, 00100 to 01999. Okay, anesthesia codes do not correspond one-to-one with surgery codes because multiple surgery codes may crosswalk to the same anesthesia code. So in case of surgery codes, like for example, few anesthesia like general anesthesia, it is already included in few codings, in few code descriptions. If we can see, especially in the surgery part, some anesthesia procedures are already included in the procedure, in the like it is a bundled code in some code descriptions. So in such cases, you will not code separately. You will not code separately for anesthesia, whether it can be a general anesthesia or a local anesthesia. Okay. Now, single anesthesia codes correspond to multiple surgical codes because the anesthesiologist performs the same task for many of the ankle procedure services, and the only variation may be time. So, for multiple anesthesia for multiple surgical codes, mostly in case of ankle procedure services, only single anesthesia will be used. Okay, for the multiple surgical codes in the same site, usually in the same site. Okay, only the time will be varying, only the anesthesia time will vary, but single anesthesia code will be using. Okay, this is an example. For example, CPT 01464. It is used for anesthesia services for any arthroscopic procedure on the ankle joint. So, any arthroscopic procedure, so whatever procedure which is carrying out in the ankle joint, this will be the same code which is to be used. CPT 01464. Okay. Services included with the anesthesia code. So, which are the services which are already included in the anesthesia code? Pre-operative visits, post-operative visits, anesthesia during the procedure, administration of fluids or blood, usual monitoring. Unusual forms include CVP, arterial line insertion, and Swan's scans are coded separately. Okay, so these are the services which are already included in the anesthesia code. Like anesthesia code will be included in all these services, so we don't have to code it separately. Okay, pre-operative visit, post-operative visit, anesthesia during the procedure, and administration of fluids and usual monitoring. Okay, now anesthesia billing CPT code cheat sheet, time report for anesthesia. This is very important. You will definitely get one question from anesthesia which is related to the time, how to report anesthesia, and also in interview questions from hospitals you will definitely get such type of questions. Okay, like how to report time for the, how to calculate time for the anesthesia. Okay, the time starts from preparing the patient for the induction of anesthesia in OP room and ends when the patient may be safely placed under post-operative supervision. Okay, so anesthesia time is calculated from the time when the patient is when the patient begins to prepare for anesthesia until the patient is being sent to the recovery. So that will be the time for the for reporting anesthesia code. Depending upon the type of service codes are listed in E&M services. So one is that, the second one is the time to report depending upon the type of service codes in evaluation and management codes. And then the third one, special services are listed in medicine. Okay, so the first one is very important, the time report for the anesthesia, which starts from preparing the patient for induction of anesthesia, that is in the OP room, okay, till the patient is being sent to recovery, like post-operative supervision, it means recovery. Alright. Now, physical status modifiers. Physical status modifiers, they are consistent with American Society of Anesthesiologists, ASA. Okay, ranking of patients, physical status. So there are 6 physical status modifiers. This is also important. You will get a question from this. Okay, like P1 to P6, P1, P2, P3, P4, P5, P6. There are 6 physical status modifiers. From that, P1 represents a healthy person. If for example, in a question which we have to code for anesthesia, for example, they might have written healthy person. The patient is healthy, so you have to mark it with the modifier P1. Okay. P2 means stable chronic conditions. The patient is having chronic condition, but it is stable. It's manageable. P3, unstable chronic conditions, not manageable. Okay, uncontrolled, unstable chronic conditions. P4, history of MI, CVA, ESRD, not on dialysis. P4 is history. The patient is having a history of myocardial infarction, chronic kidney, ESRD, and stage renal disease, all this. Then, which is not on dialysis, and stage renal disease but not on dialysis. In such cases, you have to append P4 modifier. Now, P5, intracranial bleeding, aneurysm, internal bleeding. Okay. P6 is coma or a brain dead patient. You will mark it with a modifier P6. So, read the question carefully. In case of anesthesia, in case of coding anesthesia, read the questions very carefully, then append the appropriate modifier. Apart from this, there are HCPC modifiers as well. Okay, see, these are the few important HCPC modifiers. You will get HCPC modifiers in the HCPC notebook, in the HCPC book, coding book. Okay, so that the table below provides the required modifiers for the first modifier position when applicable. These are some important ones. Modifier information built by an anesthesiologist, and then modifier information built by a CRNA. Okay, or a CRNA means certified registered nurse anesthesiologist, CRNA. So AA, what is modifier AA? The description and when to append a modifier, it is marked in the table. AA, anesthesia services performed personally by the anesthesiologist, and the anesthesiologist itself is providing the anesthesia service. Then append it with modifier AA. When to append a modifier? Append modifier when performed only by the anesthesiologist. Same. Okay. AD represents medical supervision by a physician more than 4 concurrent anesthesia procedures. So AD, medical supervision by, there will be another, apart from the anesthesiologist, there will be another physician who is supervising. The physician is under the medical supervision of that physician. Then you have to append modifier AD. Append modifier when service was supervised by an anesthesiologist. Okay. Now QK, medical direction of 2, 3 or 4 concurrent anesthesia procedures involving qualified individuals. So more than one, like 2, 3 or 4 concurrent anesthesia procedures, then You have to mark with modifier QK. Append modifier when these concurrent procedures are under the direction of the anesthesiologist. Yes. Now QY. Medical direction of one certified registered nurse by an anesthesiologist. If it is only one certified registered nurse, append with modifier QY. Append modifier when one CRNA or AA is under the direction of anesthesiologist. Okay, CRNA, certified registered nurse anesthetist. Okay. Now, modifier information built by CRNA. If a modifier which is built by CRNA, these two, see QX and QZ. What is QX? CRNA service with medical direction by a physician. QZ means CRNA service without medical direction by a physician. But who is doing the anesthesia? The CRNA. Append modifier QX. I am talking about QX now. Append modifier when CRNA or A provides service under the medical direction of a physician. CRNA or AA. Who is AA? The anesthesiologist. So, the anesthesia is being carried out by CRNA, either by CRNA or AA under the medical direction of a physician. Then you have to append with modifier QX. And then QZ, if they are giving the anesthesia but without any medical direction by a physician. Then append modifier QZ. Okay, so these are some important HCPCS modifiers. Apart from this, there are many more modifiers as well, anesthesia modifiers as well. Okay. Now, ASC, Ambulatory Surgery Center, ASC anesthesia billing. How to bill or how to code for Ambulatory Surgery Center anesthesia codes. CRNAs are as full-time employees. The billing process for anesthesiology services typically follows certain guidelines. Here is a detailed overview of how ASCs bill for anesthesiology services. Two ways. One is documentation and coding. Let's discuss one by one. Then identifying the appropriate billing party. Documentation and coding. Accurate documentation of the anesthesia services provided is crucial. The anesthesiologist or CRNA must document the pre-operative evaluation, the anesthesia care plan, and the post-operative notes. So the first thing the anesthesiologist or the CRNA have to document is the pre-operative evaluation, okay, anesthesia care plan, and the post-operative notes. The ASC must assign appropriate CPT codes and modifiers to the anesthesia services rendered. CPT codes specifically designed for anesthesia services are used to describe the complexity and duration of the procedure. So the ASC, the Ambulatory Surgical Center, must code the appropriate modifiers like how the anesthesia services is being rendered, is being provided. Okay. And that anesthesia code must describe the complexity and the duration of the procedure. Now, identifying the appropriate billing party. ASCs have different options for billing anesthesiology services depending on their specific arrangements. It could be a bundled billing or it could be a split billing. In case of bundled billing, some ASCs may choose to include the anesthesiology services in their overall facility fee, billing payers directly for both the surgical procedure and the anesthesia. Some services will be bundled. According to the documentation, you have to find it out. Split billing. Alternatively, ASCs may opt for split billing, where the ASC bills for the facility fee and the anesthesiologist or CRNA bills separately for their professional services. Okay, few split billing, like separately anesthesia will be charged, few will be bundled, as I have mentioned earlier, like surgical codes and all. Okay. So these are few important guidelines, few important topics from the anesthesia part. Apart from this, there are many. I had already discussed few guidelines in the initially, like when I had started the channel. You can refer it in the earlier videos. Okay, there is chapter wise. I had mentioned it there. So in that, there are a few more guidelines as well under anesthesia. These are few very important guidelines which you will definitely get in the examination. Okay, either of this will be definitely will be getting in the examination from the anesthesia part. Now I will be coming back with the examination pattern, how you will get questions or what type of questions you will be getting. I'll be coming back with that soon. Okay friends, hope you like the video. Hope this video is useful. If you have any queries, please mark it in the comments. And thank you so much for watching my videos and supporting. So if you like the video, please like and share it among your friends. Thank you so much friends, and stay tuned. Bye. Take care.